Hi, today we will discuss the ICD guidelines for late effects or sequela. Now, what are late effects? Late effects is the residual effect which has no time limit. So this could be one day after the previous illness or year after the previous illness. And this residual effect is due to a previous illness or injury. So this could be an illness or injury. And when we use late effects code, we don't have to use the code for the active condition of the given illness or injury. Now, ICD guidelines guides us to use two codes for the late effects or sequela. The first code will be for the given condition for which the patient came to the doctor or to the physician, and this condition is coded as the principal or the primary diagnosis or sequenced first, whereas the late effect code or the sequela code is always coded as the secondary diagnosis, or this is sequenced second. Let's take an example for the late effect due to an illness. The example is barrel chest from Rickets. The guidelines tells us to use two codes, so we are going to use two codes. First, for the given condition, which is barrel chest in this example. So we will code for the barrel chest M95.4 as the primary diagnosis, whereas the sequela or the late effect code will be coded as the secondary diagnosis. So in this example, the given code for the sequela of rickets is E64.3, which is coded as secondary diagnosis. And of course, we won't code E55.0 of active rickets in this condition. Another example for this late effects due to an injury example is scar from burn of hand. We are going to use two codes as per the guidelines. The first code will be code for the condition, and in this example, the condition is the scar. So L90.5 will be coded as the primary or principal diagnosis, whereas the late effect or the sequela code of the burn of the hand will be coded as the secondary diagnosis, that is T23.069S. A guideline tells us to use the seventh character code for the injury conditions. Then the late effects for the external cause. ICD guidelines guides us to code for the external cause code with the seventh character S for sequela. These codes are used with the sequela resulting from the previous injury, as we have already discussed. Late effects codes are used with previous injury, and therefore we don't use or never use these codes with the related current injury code or the subsequent visits for the follow-up care. Next guideline is for the sequela of the cerebrovascular disease. The codes from category I69, that is sequela of cerebrovascular disease, is coded, which covers the neurologic deficits that persist after initial onset of conditions classifiable to categories I60 to I67. And for I69, if hemiplegia, hemiparesis, or monoplegia is identified, then we have to find out whether the dominant side is affected. And default for dominant side is for ambidextrous patients and right side, and for the non-dominant side, the default is the left side. Next guideline is for the sequela for the complication of pregnancy. The guidelines tells us to use two codes as for the illness or injury. The first code will be for the given condition for which the patient has come to the doctor, and this condition will be sequenced first as the primary diagnosis, and the late effect or sequela of the complication of pregnancy will be coded as the secondary diagnosis. So in this case, O94 code For the sequela of complication of pregnancy, childbirth and puerperium will be coded as the secondary diagnosis. Finally, thank you for watching this video till end. Please like and subscribe to this channel, and don't forget to click the bell icon for new video notifications. Thank you.